Afternoon, ladies and gentlemen. I want to start the briefing today with the latest on our response to the devastation of Cyclone Harold. After being thoroughly health screened, our disaster officials have arrived with food, shelter kits, and medical supplies to Watulele, to Kandabu, to Mbenga, Yanuda, and southern Lau. We've shipped water to areas that need it as well. Deployments to the Sawas and Mamanudu groups will depart this evening, and our evacuees are gradually returning home, but those who need to stay will continue to be fed and looked after. The director of NDMO is here with us this afternoon, who will be able to answer any questions that you have. We remain in a state of natural disaster from Cyclone Harold. Today, we are declaring another state of natural disaster in response to the coronavirus threat, because it is clear we need to bring every resource in government to bear to take on the crisis of contagion and climate change before us. Our coronavirus containment remains focused on our three high-risk locales, the Namboa settlement in Suvavou, the quarantine facilities in Nadi, and the Soswa settlement and other areas in the north. Our first 16 patients living with the coronavirus are all in stable condition. Yesterday, after testing 10 samples, we recorded no new positive cases of coronavirus. Today, however, one of our 25 tested samples returned positive, that of a 21-year-old man in Bonolevo. This gentleman is a relative and traveling companion of case 9. They traveled together from India to Singapore and on to Fiji. Since his return to Fiji, this young man has not shown a single symptom of the virus. You will recall our original case definition for virus testing required that patients display symptoms. Upon returning to the country from overseas, this young man was in self-quarantine for 2 full weeks, up until the 5th of April. Free of any symptoms throughout the virus known 2-week incubation period, by all appearances, he was in the clear. But as experts have unveiled more about the insidious nature of this virus, and our understanding of the diseases involved is evolved, the way we define and contain case must evolve as well. From this week, we widen our testing to all close contacts of all our confirmed cases, regardless of whether they are displaying symptoms. That's how we identified, tested, and confirmed this gentleman as our 17th case. He was immediately entered into isolation upon testing positive today, where he is in stable condition. His close contacts have been entered into separate isolation facilities. This all goes to show that the knowns of this virus pale in comparison to the unknown. What we do know is this: physical distancing is the only strategy that stops this virus. The disease cannot move if its carrier doesn't. So while there is no medical cure, time and distance are two surefire ways to put a stop to its transmission. But as we have seen, the time that is needed to ensure it cannot be spread can be far longer than the world first thought. And it's why we are now extending the quarantine period to a full 28 days, both for anyone who is newly quarantined and to those who currently are waiting out their initial 14-day period. So for example, if you are on day 7 of your quarantine, you will remain in quarantine for 21 more days. Anyone whose quarantine has ended will not go back into quarantine, but they will continue to be monitored by the Ministry of Health until they meet the full 28-day threshold. Our contact tracing stemming from this latest case has revealed the need for additional lockdowns on Voreqe. The Vunidangi settlement between Nambuwalu and Lambasa will be locked down for the next 28 days. The settlement will rise along a stretch of vital highway, which vehicles will still be allowed to traverse under 24/7 police monitoring, as no alternate routes into Lambasa exist. However, no passengers will be allowed to disembark or embark. No one in and no one out. Our lockdown of the Suvavou settlement as well will be extended another 14 days, in line with our 28-day quarantine policy. Given the continued risk of transmission on Voreqe, our ban on inter-island travel by air and sea will remain in effect. Meanwhile, there is good news to report in Suva. Around 180,000 Fijians in the Suva confined have been screened by our mobile teams and at our fever clinics, well beyond the target of 150,000, and an impressive 2/3 of the total population of our largest urban hub. Today, that total will likely surpass 230,000, meaning that when combined with previous screening in Lotoka, over 280,000 Fijians, have been screened. This represents the most ambitious public health screening campaign in Fijian history. That success is shared by our healthcare heroes, our disciplined forces, and the thousands of Fijians who stepped up and got themselves screened. We've also successfully identified and quarantined all of the close contacts of our Suva COVID-19 cases. These Fijians will remain in quarantine for 28 days. We know the triumph of a single battle doesn't assure our victory against this virus. We know we're still in for long and difficult months ahead. But winning these small battles day after day after day is what will win us this war. We'll need to see similar successes replicated many times over in the months to come as we expand our large-scale screening to Nandi, Mba to Tavua, Rakiraki, Lambasa, Suvavou, Singotoka, and Korovou. The progress of our screening and contact tracing has kept us on track to lift the lockdown of the Suva confined area by 5 a.m. tomorrow. The Namboa settlement, however, the site of the two of our coronavirus cases, is still a high-risk region. Given how long this virus has proven it can stay dormant, the Namboa settlement will remain locked down for an additional 14 days. I want to be crystal clear with everyone watching. Even though the Suva lockdown is lifting, every other life-saving directive in place will remain in place. The nationwide curfew remains in effect. Nightclubs stay closed, gyms stay closed, cinemas stay closed, pools stay closed. Public gatherings are not permitted. Physical distancing of 2 meters from all others should be maintained at all times. The end of the lockdown is not cause for celebration. It is not a reason to have large grog sessions or drinking parties. It is not a justification to stay out past 8 p.m. It is not an excuse to leave your homes for no good reason. In the West, Fijians who have returned from overseas remain under closely supervised quarantine. One flight is arriving tomorrow from Auckland. Every passenger aboard will head straight to one of these facilities. As I said earlier, the period of quarantine is now 28 days. If you've already been released from quarantine after returning from overseas, prepare for a visit from one of the health officials. Our schools were scheduled to open next week, Monday. Instead, schools will not open until the 13th of June, an extension that recognizes that this virus will be part of our lives for the foreseeable future, and we must plan accordingly. The date schools reopen is subject to change based on the situation on the ground at the time. The Minister for Education joins me today to talk about how our ministry will continue to ensure that learning materials are distributed for at-home schooling, technology will be impactfully utilized, teachers and parents will be engaged, and our students can utilize this as an opportunity for upskilling and professional development. So even though the super lockdown will be lifted tomorrow morning at 5 a.m., I want today's main takeaway to be that every other health protection measure remains in effect and will be enforced. Every would-be lawbreaker can bet that they will be arrested and they will be charged if they flout any of these measures. The coronavirus is the most complex and devastating global crisis of our lifetimes. We should all respect how vital our health protection measures are to the well-being of every Fijian. We need every Fijian behind them, because as we've seen from the beginning, we are stronger together, and only together can the war against this virus be won. Thank you, God bless you all, and God bless Fiji.